Nice to be here. I'm Guy Ringler, and I'm a fertility specialist with California Fertility Partners in Los Angeles, where I've been practicing helping individuals and couples have babies for almost 30 years now. And I think this is a great topic for discussion because I think second opinions are very important. And just Eloise and I were talking a little bit earlier about when is the best time to seek a second opinion. And I think for number one would be after 2 or more failed treatment cycles. It makes sense to seek a second opinion, just to have another professional's eyes, review everything, because they may have new ideas, new insights to make changes. The second reason would be if after a failed cycle, no attempt was made to explain what may have gone wrong or attempt or to discuss possible reasons. I think it's very important after a failed treatment cycle to review each variable to try to determine, if we can, what may have been the cause for failure. Oftentimes we can't, but I think it's important to reevaluate each variable. What was the egg quality? What was the sperm quality? How did the embryos look? To try to understand what changes we might make to try to improve the outcome next attempt. And then I think lastly, if you feel like your concerns are not being heard by your care team, your physician support staff, it may be in your best interest to seek a second opinion where your concerns are being heard.
Do you find that lots of patients who come to you are very well read and they come in sort of knowing what they want and have read about what might be a good thing and what they might think is bad and depending on whether they've had treatment before or not?
Yeah, absolutely. Fortunately, our patients today are very well read. They do their homework and they have an understanding, and they're bright people. They ask very good questions, and I encourage my patients to investigate, to do their own reading, because it's you need to be your own advocate, and by asking good questions, you'll make sure that your care team is looking at all angles, which they should be, but I always appreciate my patients' questions.
Absolutely. As you said, there's no stupid question, is there? And people shouldn't be afraid to ask things. It's such an emotional and big thing that people are doing.
Absolutely. And I think you should try to understand as much as you can the process. And I'm very big on patient education. I try to teach my patients an understanding of what they're going through. And, what we look at and what's important to me to try to optimize your outcomes.
Definitely. So I'm going to ask you some questions that came in advance, Dr. Ringler, if that's okay. And for those who are watching and have additional questions or something that hasn't been raised, please feel free to ask as we go through and we'll make sure we get to them. Less conventional tests that might unearth causes of unexplained fertility issues.
We always do a thorough evaluation to try to investigate the cause of infertility. But as you know, sometimes we can't pinpoint a cause, and oftentimes it's several potential factors. It may be age of the ovaries, impacting the quality of those eggs, the genetic makeup of the eggs. In many couples, it's a combination of male and female factors. So there may be a mild male factor where the sperm quality is impacted, maybe a slightly decreased sperm motility, increased percent of abnormal forms. There may be something about the uterus that not creating a receptive lining. So we look at each variable: egg, sperm, the uterus, the uterine lining, systemic factors, to try to optimize each variable. And there's some newer tests, for example, that test the receptivity of the uterine lining. The test is called an endometrial receptivity assay, and it allows me to fine-tune the hormonal preparation for a frozen embryo transfer. Some women need a little bit more progesterone, some need a little bit less to place the uterine lining in the middle of the window of implantation for the time of the embryo transfer. So that's a prime example of a newer test that may help explain the reason for multiple frozen embryo transfer failures.
And does every clinic run that kind of test, or is that something that's quite new that you're rolling out?
It's readily available. It was actually developed in Spain, but it's available around the world now. And so if it hasn't been brought up in discussion, you should ask your doctor about it.
When you have seen patients, or patients may have questions about when might be a good time to seek a second opinion, would you say that it might be more necessary to move quickly to seek another opinion if you're doing IVF at a slightly older age?
Absolutely. The age of the ovaries is very important because it impacts, as I just mentioned, the percent of eggs that are normal and abnormal. So when we do genetic testing on our 25 embryos from our 25-year-old egg donor, we find that about 30 to 40% of embryos are abnormal, 60 to 70% normal. By age 35, approximately 50% of embryos will be abnormal, 50% normal. By age 40, 65 to 70% of embryos will be abnormal. So age has a profound impact on the chance of that egg having the correct number of chromosomes and that embryo being normal or abnormal. So you don't want to waste a lot of time if you're over age 40. So you really want to get your second opinion earlier. You want to make sure that everything is being done to optimize your success rate. Besides age, how the ovaries are stimulated can have an impact on egg and embryo quality. So in our practice, we monitor our patients very closely, and as each physician sees his or her own patients to perform the ultrasounds, to take the measurements, because we make very important clinical decisions based upon that data, and we want to make those decisions ourselves. So very careful monitoring is very important. The timing of the egg retrieval is very important. Over the age of 40, if you remove the eggs too early, of course, they'll be immature, but if you remove the eggs too late and overstimulate the ovaries, it has a potential negative impact on egg and embryo quality. So timing becomes very important.
It makes absolute sense. And for people who are apprehensive, this is the next question. They're worried about offending their clinic or specialist. What's your advice around that?
Now, it's very important that as a patient, you are your own advocate, and second opinions are helpful. And our patients seek second opinions all the time, and your physician is used to that. So I think it's important for you to be your own advocate, look out for yourself, and the staff won't be offended. They realize that you're looking out for yourself and trying to obtain as much information as possible to try to get your best outcome.
And can it run in conjunction if you're having treatment somewhere, that you go and seek another opinion at the same time, or is it kind of you finish with one clinic and then you go and see someone else?
I think you can go and seek a second opinion. You can't do treatment at two centers at the same time, but a second opinion is about educating yourself about other possibilities that may be explaining why it's not working. And you may find out some very useful information that you can present to your treating doctor and say, I saw Dr. Smith and he thought, maybe that we should look at this. And, so your physician may find that information helpful, and he may be able to change something to try to improve your outcome. It's really about trying to get the best outcome for yourself.
Absolutely, yeah. How can patients be better advocates for themselves? Because ultimately, you're your own advocate, aren't you? And you're the driving force behind not what happened, but decisions have to go through you. So how can patients work out what's best for them?
I think it's important to educate yourself, attending, sessions like this, reading on the internet, and asking a lot of questions. Ask the support staff, ask your physician, and you want to make sure that you are being heard and your questions are being taken seriously. and you're receiving answers that, to your questions.
Do you think it's okay to question a protocol that a doctor might put you on and say, can I ask why we're not going for harder stimulation, or why we're not trying this drug, or why you're not stimulating me for longer, or what's changed since the last cycle?
Absolutely. My patients ask me hard questions all the time. And, I have an answer. When I select a protocol, when I make changes to the protocol, there's always a reason. And I share that with my patients, but if they don't understand, or, it's not uncommon, as you mentioned, for patients to ask, why don't we use a higher dose? Well, I don't like high dose protocols because of this and this and this. So there's always a reason. And so when you ask those questions, make sure you get an answer that you're satisfied with.
I presume you have that as well with how many embryos to put back, that patients are really keen for multiple to increase chances. Is that something you see a lot?
Well, 5 to 10 years ago, absolutely. 5 to 10 years ago, we would most of the time put back more than one embryo. But today, due to advances in pre-implantation genetic testing of embryos, most of our patients will do genetic screening of their embryos. So today, 90% of our embryo transfers are single embryo transfers, because we are able to achieve a high pregnancy rate of approximately 70% and minimize the risk of a twin pregnancy, which is a high-risk pregnancy. I do have some patients that hope to have twins, but we always have a very complete discussion about the potential risk of a twin pregnancy. In general, most pregnancy complications occur more often with twins. You have increased risk of miscarriage, increased risk of diabetes in pregnancy, increased risk of hypertension in pregnancy, and the big risk is preterm labor and delivery. The goal with a twin pregnancy is to keep the babies as long as you can, to avoid them having to spend any time in the neonatal intensive care unit. In general, it's always safest for babies to be born one at a time. And that's what we want. We want a high chance of pregnancy, but we want a safe pregnancy with the baby delivered at term.
Absolutely. Now, what about a second opinion for someone who's had unexplained fertility diagnosis?
I think if your questions are not being answered as to why you're not getting pregnant, or you feel that the appropriate workup has not been done, it's not uncommon for me to see patients with the second opinion where maybe every factor hasn't been evaluated fully. So by being familiar with the infertility evaluation yourself, should have a sense of whether or not everything's been tested. So I think a second opinion would be helpful in that situation. Or even though unexplained infertility means we can't find a reason, but your doctor should be able to provide you with what possible explanations are. And there's always a hint of something. We may not have a definite male factor, but maybe there's a hint of a male factor. Maybe there's something about the uterine lining that's concerning, or something the way the ovaries respond that you want to make sure that you are given some potential reasons for why things aren't working.
One thing I've heard a lot from readers, actually, and you would be the expert on this, but if someone is seeking a second opinion and they're moving clinics and they have embryos from the original clinic, what's your advice around whether to try and create new embryos with your new embryology team and new specialists with different, obviously, different lab, or to transfer those embryos over? Do you see a difference in success rate depending on whether people come and make embryos with you versus transferring previous embryos?
You want to ask your physician what the quality of those embryos are. What are the grades? And what is the pregnancy potential of those embryos? Are they very high grade quality embryos with a high pregnancy potential, or are they very borderline embryos with a maybe pregnancy potential? It's always important for your your new clinic that may be receiving frozen embryos to be familiar with the protocol that was used to freeze those embryos. So if your current clinic uses a unique protocol to freeze and thaw embryos that your new clinic is not familiar with, it's really best to use up your embryos in your current clinic. Our laboratory will not accept outside embryos unless they're familiar with the protocol used and the straw that the embryos were frozen on. So that's important for you to inquire about.
Absolutely. The same lady as before said, my embryos were developing well at day 3, but unfortunately day 5 out of 7 arrested at day 5 blastocyst. Do you think day 3 would have been a good day to transfer rather than a day 5 transfer with poor quality embryos?
You know, laboratories today, most are very high quality, and we never do day 3 transfers anymore because the laboratory environment allows us to select out the highest quality embryos. If an embryo did not make it to day 5 in the laboratory, it most likely would not make it to a day 5 blastocyst in the body. So the whole purpose of extended culture is to give the embryos a chance to prove their health and viability. If an embryo is going to implant to start a pregnancy, it has to develop the blastocyst stage. So when we have poor blastocyst formation, it's a signal that there's an egg or sperm issue that's not allowing the embryos to develop normally. So we really rely on the development of embryos in culture to give us information on egg embryo quality and give us insight perhaps in why someone's not getting pregnant. But no, I think it's important to give them 5 to 6 days in culture to really to prove themselves.
Do some people think, or is there some belief that some embryos may do better in a natural environment in the womb than in a lab?
Well, that's the argument that's been presented. During the 10 years ago or so, it was longer now, 15, when we were making a transition between day 3 culture and day 5 culture. The theory was presented that perhaps the body does it better in the laboratory. But today in high quality IVF labs, the laboratory conditions are excellent, and they're providing these embryos, conditions, the equivalent, if not better, than the human body. And I'm a big believer in genetic testing of embryos, especially in older women, because it allows us to screen out the normals from the abnormals. And an embryo must reach a blastocyst if we're going to be able to biopsy for genetic testing.
Yeah.
The laboratory conditions continue to improve. Genetic testing has improved. And so pregnancy potential with IVF is really higher today than ever before. When you're exploring different IVF programs, you want to ask them about their laboratory, ask them about their success rates, ask them about the experience of their embryology team. How many embryologists do they have? What's their success rate in freezing and thawing of embryos? Because in a high quality IVF lab, they should be very skilled at the freezing and thawing of embryos, because most of our embryo transfers today are frozen embryo transfers, not fresh transfers. So in our laboratory, the survival rate of freezing and thawing of blastocysts is 99%. Because we have a very highly skilled team of senior embryologists. They're really experts of handling, freezing and thawing blastocysts and eggs today.
You also have a state-of-the-art lab, don't you?
Because we built a new IVF lab 4 to 5 years ago, because we wanted to provide our patients, state-of-the-art laboratory conditions to give those embryos the best possible environment in which to grow and develop. What
to do when you lose faith in your clinic? Do you think you can turn that around? Do you think a clinic can restore faith in people?
Hopefully, if you're not happy for a reason, there's someone in the clinic you can talk to about it, and maybe there's an explanation, or maybe something happened and they have an explanation for why that was so. But it's really important for you to have trust in your medical care provider. This, fertility treatment is very emotional, very expensive, and you really want to have great faith in your team. And if you don't have that trust, faith, respect in your team, then it really is best to get a second opinion elsewhere.
Absolutely. And are admin issues a thing with all clinics? Would moving clinics make a difference? That's really good to hear. I'm just going to move on to this slide. Could you just tell us a little bit more about California Fertility Partners and who you help, and if anyone wants to speak to you about the topic tonight, or just for a general consultation or next steps, then what you can offer basically?
Sure. Our IVF clinic was established almost 40 years ago. I wasn't here. My senior partner, Richard Mars, started the program, and it was one of the first IVF programs in the world that developed IVF to help couples with infertility. And I've been in the practice for the last 30 years. We have a very diverse practice. We see patients all over the world who come to us for our expertise in IVF, as well as for treatment options that aren't available where they live. For example, egg donation, surrogacy, gay family building. So we see patients who come to us around the world, from the UK, throughout Europe, China, Japan. And I love the practice. I love what I do. The science is always interesting. And so when I see patients from the other side of the planet, it adds a cultural diversity that's always fascinating. I always like to hear my patients' stories and help them have babies.
Of course. And if anyone's in the UK or Europe and contemplating having treatment in the US, then you can always ask me any questions too, because I've done it. And so it can, it's not as daunting as it sounds in terms of planning and scheduling and talking.
Yeah, everything, we start with a Zoom consultation. Even, pre-pandemic, we were doing Zoom consultations with our patients from other countries. And with the internet, communication is easy. During the pandemic, when patients from Europe couldn't travel, I arranged to have several different clinics in Europe freeze sperm for my patients. So they could freeze the sperm there, do all the required infectious disease screening, and then a courier would bring the frozen samples, still do, for our laboratory here, so they can continue on with their family building plans through egg donation or surrogacy. Should also mention our program is one of the first in the world to help gay men to have babies through the combination of egg donation and surrogacy. So we continue to see patients for egg donation surrogacy, because surrogacy is not legal in most countries of the world.
Absolutely. If you want to get in touch with Dr. Ringler or any of the team at California Partners, there are the details. Does anyone have any questions for Dr. Ringler whilst we've got him? I was just going to ask you, actually, before we end this topic, what should people think about when they're choosing a fertility clinic or looking for a second fertility clinic? What are the important things to be aware of?
I think you want to, ask your general physicians about reputations and what are the best clinics. You want to choose someone that you feel comfortable with, not only the physician, but their support staff. You ask what their success rates are, and talk to your friends. You want to feel comfortable, cared for, and listened to by your care team. I think it's very important.
Absolutely. Well, thank you so much, Dr. Ringler, for some very sound advice, and it's always a pleasure speaking with you.